Hi, I'm Danish Nadeem. Climate change will be the biggest problem in the 21st century, as the effects of climate change will break our systems. Well, who is saying this? In Canada, for example, we have our Prime Minister Justin Trudeau reiterating that statement. And in the US, we have Senator Bernie Sanders also agreeing with that stance. Sources of mainstream media such as CNN and Fox News have also stated when having debates about climate change. The three major talking points about this theory are food insecurity, failure of infrastructure, and decline of public health. The first talking point is about food insecurity. It states that extreme weather due to climate change reduces crop yield and will result in a disruption in the supply chain. Therefore, food will become unaffordable and increase food insecurity. It is accepted that climate change will increase the frequency of extreme weather events. A study explored farms in Ethiopia. The study projects them to be one of the most vulnerable countries to extreme drought due to climate change. The study said that an increased frequency of drought due to climate change had reduced crop yield and directly caused food shortages and famines. During the COVID-19 pandemic, there was an issue of food shortages, and the cost of food increased drastically. The study stated that flaws within the food supply chain were vulnerable, and this was revealed through the events of the pandemic. COVID restrictions disrupted the supply chain, and the food that was delayed in the delivery lost its value as it is a perishable item and rotted away. This resulted in an increase in the pricing of groceries and made it difficult for families to afford. One of the systems people defaulted to in response were food banks. The demand for services from food banks increased drastically, yet the food banks were unable to provide services to keep up with the demand. The second argument in the theory is about public infrastructure. The theory states that as extreme weather becomes more frequent due to climate change, the damage it will bring to public infrastructure will be too much for the government to maintain. An example of this would be in 2021, Texas experienced a winter storm. According to a report from the Texas Department of State Health Services, the state lost power as its power grid could not handle the extreme weather conditions. Infrastructure that relied on the power grid, such as heating and water, also failed and left the people of Texas vulnerable to the cold. It resulted in 246 deaths. Another study from the Financial Accountability Office of Ontario had done a study based on the causing of climate change and the impacts of public infrastructure, and they state that the freezing and thawing cycles that occur in winter will occur more frequently and will accelerate the weathering of infrastructure. The same study also pointed out how ceramic bricks, such as ceramics expand as heat is applied, and states that this is an issue as as bricks, which are also ceramic, expand during heat waves, and the repetition of that will cause an increase in weathering. And again, in the same report, it states that during a medium emission scenario, maintaining public infrastructure will cost an extra $800 million per year just for the province of Ontario until the year 2100. It states that it poses a big threat to the province as it expects, due to financial constraints, the province will not be able to keep up with the maintenance of its own public infrastructure. The third point is the increase in of health risks as the result of warmer weather due to climate change. It says that as environments become warmer, pathogens and parasites can better survive in these environments and cause harm to the people around them. For example, the CDC states that the most deadliest animal in the world is the mosquito. A report from the Government of Canada stated that as temperatures increase due to climate change, the incubation period or the period a mosquito lays dormant is reduced as a result. And, and as a result, the mosquito are maturing at a faster rate, therefore increasing the mosquito populations and increasing the spread of pathogens. The same report also stated the same behavior for ticks. Stated that in the season where activity is the most, the increase in temperature allows ticks to continue their activities for a longer period and increase the transmission of tick-related diseases such as Lyme disease. Again, in the same report shows that foodborne illnesses are further spread with the increase of precipitation temperature and water temperature. And this is an issue because a report from the Health Coalition of Canada stated that before the pandemic, when hospitals were at 100% capacity, there was a drop in quality and patient care, and making infections harder to control even within the hospital. During the pandemic, hospitals were operating over 100% capacity, and doctors and nurses were unable to provide quality service to the patients in need. A report from the National Library of Medicine stated that during the pandemic and the increase of demand from COVID patients alongside with COVID restriction and inadequate amount of resources such as PPE and human resources, hospitals were unable to perform as many surgeries as in the years prior. This means that the system that will take care for the sick could not handle a challenging event such as COVID's increase in demand. Therefore, will also have a similar outcome when climate change will result in events causing more of the population to be sick. In conclusion, by reading peer-reviewed studies and reports that have explored how the aforementioned systems have handled previous challenges, we have drawn to the same conclusions that climate change and its effects will cause a failure in those systems. The food supply chain is vulnerable to a reduction in crop yields due to extreme weather. Public infrastructure will weather at a faster rate due to extreme weather, and public health will be challenged as mosquitoes, ticks, foodborne illnesses further spread, and the hospitals will not be able to keep up with the increase of demand to treat patients. Thank you for listening.